body. What is the recovery period for unilateral breast reduction? So you know what? It's similar to the wrist, the tattoo on the wrist. Having said that, breast reduction is obviously, or may not be obvious, but it's obviously a bigger operation than a tattoo removal, and there's quite a lot of scarring with a breast reduction. And anytime two scars meet, there's a risk of wound healing issues. So with a breast reduction, you have a scar around the nipple, scar straight down, so where that sort of, there's a T junction at the bottom of the nipple, and then there's often a scar in the fold as well. So there's another T junction at the bottom. So there's kind of like two places where there's T junctions, and so you can have problems with the healing there, particularly the bottom one, the bottom T, that can give you issues with the healing. So again, aim for it to be healed in a week, and usually for pretty much all the operations I do, it's dressings for a week, whatever operation you're having. The bigger operations are just more risk of healing problems, but hopefully you don't get healing problems in any operation, but the risks are greater with the bigger ops. So a unilateral breast reduction is kind of, it's good because it's one side. Obviously a bilateral breast reduction, you're kind of doubling your risks of complications with that, simply because you're doing both sides. But yeah, wounds heal in a week, and then again, scars red and obvious a few months, and then they settle after a few months. So and in terms of driving, things people often ask about driving, 2 weeks. It depends on how big the reduction is, really. Sometimes people are okay after a week. It's hard to be too kind of like what's the word, like wide about you can drive after 1 week with a breast reduction, because there's breast reductions, so it's kind of depends on the person. So kind of 2 to 3 weeks is normal, but if it's a unilateral and it's just a little balancing one, it might not be too bad. It might be 1 week. So it's hard to know in terms of driving and returning to work. Similarly, it depends on what you do, and if you have to drive to work, then it's going to be that same sort of amount of time before you can drive. So yeah, that's kind of overview, but it would be on a case-by-case basis. So be a bit more specific when we know your exact case.